Okay, so this is video submission for the final practical. So we're gonna go with, we're gonna look at our order and explain if it has everything we would expect it to. So to make an order valid, it has to have the patient's name, patient's date of birth, the procedure that we're gonna be performing, doctor's name and contact information, and then it has to have a diagnosis code, and also the doctor's signature, which I think everything is on the order, so I think we're good. It's a valid order, but I just want to point out that the procedure that we're going to be performing says MRI of the right ankle without contrast, but the patient screening form, I believe, says that we have to screen, or we have to do an MRI of their right foot and not the ankle. So I'm guessing that we're gonna have to call the ordering physician to confirm and maybe get an accurate order that matches the patient screening form. So, and then, okay, so it is a valid order since it's complete. And then we're gonna go, after we check the order, we're gonna go to zone 4, but then of course, before we could go into the scan room to do our setup, we gotta demetalize, check ourselves, all pockets for phone, keys, wallets, watches, jewelry, any bobby pins or clips we may have, any loose change, and our ID badge if it has any type of metal in it. And so for the setup, we're gonna be we have to disinfect everything, all high touch surfaces, all patient care areas, our MRI table, and then doorknobs. And then we have to place the clean linens or pillowcases, paddings on the table. We're gonna select the proper coil that we'll be using, which for this exam is gonna be the foot. And then we're gonna lower the table all the way down. We're gonna ready our coil. I mentioned that coil. We have to have our headphones or earplugs for hearing protection. And then we're gonna close the door and then go get our patient from zone 1. Okay, so after setup, we close the door. We go to zone 1 to get our patient. We have to call the patient with either their last name or their first name, or it depends on the facility, I guess. Some sites allow you to use both first and last name. And then we're gonna be starting our AIDIT. So we're gonna acknowledge the patient, call them out, and then we have to introduce ourselves. Hi, my name is Jerome. I will be your MRI technician. I will be assisting you with your exam today. So we introduce ourselves, and then we're gonna inform them of the duration of the exam. Like for today, we're gonna have their MRI of the foot, which is gonna take 45 minutes. So we're gonna inform either them, the patient, or the patient's family, and then we're gonna offer or ask them to use the bathroom before we could proceed. And then so after zone 1, we go to zone 2. We have our screening form. We're gonna now we have to verify, we have to identify our patient using our patient identifiers. So like there's 4. So first, we're gonna confirm with their first and last name, confirm their date of birth, and then sometimes we could ask them for an ID identification, or ask them why they're here. Why are they here for an MRI today? Like, so why are you here? And then their answer should match what is on the physician's order. And then we're gonna have the patient change clothes from street clothes into hospital gowns, and then we have to instruct them to be specific how to put on their nightgowns, that the opening goes on the back, and then we're gonna tie it on the back. We have to instruct them specifically and assist them while getting changed. And then we're gonna ask them to lock up everything, all their valuables, like how we check ourselves before we go into the scan room. Like, we're gonna ask them to lock up cell phones, keys, wallets, any type of jewelry, any loose change they may have, bobby pins, hair clips, earrings throughout their entire body. And then we're gonna be starting our thorough history, like asking them questions about their foot, because that's what they're here for on that day. We're gonna ask them what happened, and how long ago did it happen, or if there's any bruising, pain, or discoloration, or is there an open wound. And then as we're going through the screening form, we're gonna do the verbal interview, and then we're gonna ask them about the yes or no questions on the screening form, if they've missed anything or unanswered any question. And then also we have to ask them the flight attendant questions. Have you had any prior surgeries in the brain, the eyes, if they've had a surgery to the ears or heart. And then we're gonna ask them if they have any metals or foreign objects inside their body that they were not born with. And then we have to ask them if they work around metal, such as welding, steel work, or cutting of metal. And then so our patient is a female, and then if they are under the age of 50, we have to ask them if there's any chance of pregnancy or breastfeeding. And then if they're not sure, we may need to do a urine pregnancy screening. So we have our screening form. We're gonna go through it with the patient. It seems like they've completed everything, all the questions. They've had a prior surgery back in August of 2020. On their right knee. And they've never had a prior diagnostic imaging study or exam. Never. No, they don't have anything prior to this MRI exam. And then it says here that the patient is a metal worker. They don't always use goggles. And then it says here that they may have a metal in the eye. So we're gonna order the x-ray. We're gonna order the x-ray and then wait for the results before we could proceed. History for female. Our patient is not pregnant. Last menstrual period was a week ago. No implants or clips. Everything was answered no. And then we have a the patient has had a joint replacement on the right knee. And then we have to ask them how long ago they've had that surgery. It also says that they have some metallic fragment or foreign body, which I'm guessing is the joint replacement on the right knee. So we asked them how long ago they've had it. They also checked yes for tattoos or permanent makeup. We have to ask them how long ago. So for tattoos, we just ask them how long ago, and then it's okay for us to do the scan if it's over 2 or 3 weeks. No implants. Patient name, print name. We're gonna have to put the date, and then we're gonna have them sign, and then also the tech sign the screening form. Okay, so after zone 2, we've finished having the patient change and lock out their valuables. Now we go into zone 3, where we can do our last minute questioning pertaining to the screening form. So it has to be 100% complete, and then the patient sign it, and then I, the tech, sign it, and then we're gonna scan the screening form into the system if we haven't already done it. And then we're gonna enter their accurate weight for SAR or specific absorption rate calculations. So this patient is a wheelchair patient, but they can stand up and pivot. So I guess we're gonna help them get up from the wheelchair, of course, because we cannot bring the wheelchair into the scan room. So we're gonna help her get up and assist them to get to the MRI table. And then so in the zone 4, we're gonna sit the patient on the table. We're gonna explain the procedure and what we expect the patient to do while we're scanning. If we need to, we're gonna place the vitamin E marker on the region of interest, which is the foot. And then we're gonna start an IV if we need to. And then so we sit the patient down. We're gonna lay them down. We're gonna put our coil, which is the foot coil, I'm guessing, because we're doing a foot, not ankle. We lay them down. We give them hearing protection, squeeze ball, and then our landmark for the foot. We're gonna put some paddings and linens around the patient for burn protection. Also, we have to inform the patient that they may feel a warm sensation because of their so this patient is all has tattoos. I guess she's covered up with tattoos, mostly her entire upper body up to the neck. And then yeah, we're gonna advance our table to scan, and then we're gonna ask the patient, we're gonna ask them if they're okay before we leave the scan room to go into our zone 3. So we sit the patient, we explain the procedure, start IV if needed, and then we place the coil, raise the table, we give them the headphones and also the emergency squeeze ball for communication. And so yeah, we're gonna place the padding around the patient, and then we're gonna advance the table to scan, and then we go out into zone 3. We do our scout. So back to zone 3, we have our patient sat on the table ready to scan. We're gonna do our scout, and then so we're doing foot. Our patient positions should be feet first supine, and then if it's possible, we have to dorsiflex the foot or the ankle. And then our landmark for the foot would be the long axis of the foot, or the metatarsals, or the tiptoes, yeah. And then we're gonna place padding in and around the foot so we can reduce motion. And then for our slice angulation and coverage for the axial or short axis, we're gonna plan the slices on the sagittal plane. We're gonna angle perpendicular to the metatarsals and phalanges, or the phalanges bones. We're gonna cover from the tip of the toes to the tarsal bones. And then for our coronal or long axis, we're gonna plan our coronal slices on the sagittal plane. We're gonna angle parallel to the metatarsals and the phalanges bones. We're gonna cover from the plantar to the dorsal aspect of the foot. And lastly, for our sagittal plane, we're gonna plan the sagittal slices on the coronal plane. We're gonna angle parallel to the metatarsals and phalanges bones. We're gonna cover from side to side. And then so while we're scanning, we're gonna check on the patient how they're doing in between the sequences, ask if they're okay. And then we could maybe talk to them. And then once we are done, we have our post-scan care. We're gonna bring the patient out. bring them out of the scanner. We're gonna remove the coil, hearing protections or pads. We're gonna lower our table down. We're gonna sit them up, and then we're gonna allow some time for them to like settle and check or verify that they're not dizzy. And then we're gonna escort them back to the changing room. We're gonna instruct them to get dressed and then collect whatever item, whatever valuable they locked up. And then we're gonna tell them, we're gonna inform them how long the result is gonna come out, and then when it's gonna be available, maybe 2 to 3 business days at the ordering physician's office. And then lastly, we're gonna thank them for coming in today, for allowing us to provide the care.